No, you should have seen Guardians of the Galaxy with me.
I wish I'd. Yeah, thanks for the invite.
Yeah, you're welcome. I thought I'd take my pregnant wife out.
I thought I was your nerd movie friend.
No, she's my ultimate nerd movie friend.
Yeah, so was it good?
I loved it.
It's gotten the best reviews. It's 96% on Rotten Tomatoes.
It was hilarious. It may have lacked little things like story and
plot lines.
Things that make sense about the universe, but it was hilarious, and so I forgave it all of those things.
Yeah, I really want to see that.
Also, killer soundtrack.
Oh, really?
Yeah, really good.
It's
all 70s, 80s music. It's even fit in with the plot of it. So it's massive space fights to Uka Chaka, right?
Oh my gosh.
It's good stuff.
Any Christian contemporary music in there from the 80s or 90s?
Interesting. No.
No?
No. It's really sad.
Guess they don't have Jesus in this Guardian of the Galaxy world.
He's the ultimate Guardian of the... Oh my God. So we haven't talked in a long time.
That's a sermon this Sunday. Being the ultimate Guardian of the Galaxy? JC, let's give it up.
Our galaxy does need guarding.
It's true.
It turns out. It's it's a real problem.
It's good to be back. It's kind of gone to crap since we've been off for the summer.
We really need to keep podcasting to hold the world together.
Maybe we're the Guardians of the Galaxy.
Oh my God, we totally are.
Oh, jeez.
All right, today on the show, what are we doing?
We're talking about weather.
We're talking about weather.
We're talking about drones, of course.
CDC's top disaster songs. We're going to reveal those to you.
Yep.
They're from 2011, but still big news.
Some cool mitigation work that LA is doing.
And we're going to break down Ebola. We're going to face this thing head on. We're going to take it apart. We're going to start from the beginning of Ebola. We're going to take it to the end and really, open it up and see how it ticks.
That's right. I was going to make a joke on that, but I'm not going to make it.
No, that's better. You want to be appropriate above everything else.
Oh, I missed it. I missed the theme song.
It's good to be back.
Good to be back. All right, first up, the news rundown. So this was an interesting article. Several news outlets carried it, but CDC published a report that said that weather kills at least 2,000 Americans a year, and 2/3 of that are from what? What do you think?
No, I got this. Here's the thing, because this is I'm putting on my massive disaster wizard hat, right?
Yes.
Because people think it's hurricanes or tornadoes, but it's heat waves. Heat waves kill 250 people a year, tons of heat wave deaths.
That's what I thought, Mitch. It's exactly what I thought, but you were wrong. Oh. It's actually, this report says cold. Cold kills 2/3 of the people were killed by hypothermia, primarily as a result of homelessness or alcoholism or exposure to the elements. But they're saying that cold kills more Americans than heat.
That's huge. And wow, it's funny because a lot of cities have moved from, I guess we're following the research, right? You move from coastal storms. A lot of people have got heat waves plans in place, but there aren't a lot of formal cold wave plans that I know of. There are protocols, but there aren't kind of massive, overarching, coordinated efforts about cold. And I think it's because, I'm just totally spitballing, heat waves are designated events. They last for 4 days, 5 days, so you can focus on that. But I'm going to guess the cold deaths are diffused across a long period of
several months, right?
Yeah, and so it's a harder thing to track.
Yeah, it probably is a hard thing to track. And also, you always run into the, how did this person really die? Was it from cold? Was it from a heart attack? Was it from a cold-related, disease that happened as a result of the cold? So, it's probably hard.
Which is a big thing that's happening in the literature right now. And to save you all from reading the literature, I'm going to tell you that...
Because who wants to read literature? Lame-o.
There are 2 ways that you track deaths, right, in coastal storms. There are directly attributable deaths and indirectly attributable deaths. So I can't even say attributable deaths. So on a medical examiner report, it might say that a person was directly killed by blunt force trauma from a coastal storm, but then you have sort of indirect deaths that might happen later that are tied to it. And there are lots of arguments about this gray area over how a death is actually tied to something. So I would be really interested to see the underlying research on how they decided what was attributed to cold, because it can make these numbers swing by just hundreds and hundreds of people.
Yeah, right. Yeah, I don't know how the article we'll post doesn't really go into it, but that'd be a really interesting question.
I'm sad. I thought I had that one.
Yeah. right. So next up, so the city of Los Angeles is doing an interesting thing. They're taking both a top-down and a bottom-up approach to hazard mitigation. So they're going to publish the results of a canvassing project to map all structures within the city of LA that is at risk of damage or destruction from an earthquake.
Oh, wow.
So it's interesting. So they're having canvassing teams go out, identify old wooden or old concrete buildings that are at risk, and then they're publishing all this data on their website. And then the buildings, once they've been cataloged, the owners will be notified and given a chance to show that their structure is sound. They'll be taken off the list. But this is fascinating because it's both a top-down, bottom-up. So what I mean by that is there's a policy out, hey, if you have a building in the city of LA, you've got to be earthquake-proof, blah, 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 blah. But then this bottom-up where they're actually sending teams out to catalog, document, photograph, survey.
Yeah.
I mean, it's a fascinating project.
It's amazing because you always think, well, cities know this, right? Like the Department of Buildings has these records from way back when the city was built. But I guess what you find when you go out there is that it's terrible record keeping. You know, like these are like old paper records from like 100 years ago, 150 years ago, and they bear no relationship to how the structures actually are.
Right. And it's probably been years since anyone has actually looked at these buildings, inspected them, etc. I mean, I know even in our city, like, the Department of Buildings is a relatively small agency compared to all the others. They have not a lot of staff, and so New York City is huge. It's a really hard job to keep track of all the buildings.
When I went to San Francisco, I went in the earthquake house that they have, and I wonder how you count that. Like if you have a house that's like a fake house built specifically to withstand earthquakes and pretend that you're in an earthquake, like how does that show up on your canvassing for the buildings?
Exactly. This is interesting. I wonder if this kind of process could be applied to other areas in mitigation. I mean, I think it works well for this because it's something that's mappable. It's something that is, there are addresses that you can go to, but I wonder if other areas in emergency management you could do similar things.
I think you can. First, what you really want is like an ecological model of a neighborhood, right? You want to be able to see the buildings. You want to know how much green space it is, where the white roofs are, how good the evacuation routes are. There are all of these data points you need to look at together. And the White House actually had this thing called the Innovation Day.
Oh, yeah.
Just a couple of weeks ago that was in Emergency Management Magazine.
Right.
And there were a bunch of things like this that were in that. They had a new thing that was a disaster assistance and assessment dashboard that was just exactly this, a way to bring all of these different data points together. And there was one that actually sounds a lot like this canvassing project called GeoQ, the National Geospatial Intelligence Agency, which who knew first that existed?
That's pretty cool.
Yeah, also that's what Ingia, which sounds like a new car, like a terrible crappy
National
Korean
Geospatial Intelligence. So do they send spies to the geospatial? What? Like, what
it does sound like a weird spy thing, like spies with globes.
Yeah, everything intelligence, I think.
Right, really good at geography.
Right.
But they have this crowdsourcing tool called GeoQ, and it allows users to upload photos of an area, and those are then incorporated into a disaster assessment dashboard. So the beauty of that is you have a canvassing tool like in LA, you have a picture of an unreinforced masonry building. After an earthquake, you go there, you take a picture, the coordinates of it are automatically mapped on top of the old data, and then you have like a before and after shot that you can use for insurance or you can use for search and rescue.
So this is a government agency that's using citizens, basically the pictures that they take, it's taking that and we'll use that for disaster response, disaster recovery. Wow,
and it's
that's
great.
Fascinating.
One thing when you dig into Twitter research, there's a site the HHS put up called Now Trending, and it tracks Twitter twins.
Yeah.
Twitter twins.
Twitter twins. I thought I saw a Twitter twin.
The Twitter twins. That sounds like it's
the
like
Twitter twins. Yeah, I remember them. They were on Full
Danny DeVito
House.
movie with Arnold Schwarzenegger, right?
Right, yeah.
That's the update. They used to be twins, now they're Twitter twins.
Right.
And but you don't have location. So like something like this, what you really need is geotagging. That's the next level of user data that would be really useful in an emergency. And the fact of it automatically syncing is genius because you would know exactly where the photo was taken.
The other thing about this is when did Q, the letter Q, become the cool letter?
I think it's Qbert.
But it seems like there's like been several things.
It's Qbert.
It's Qbert. That
you don't think it was
Qbert? Maybe, but there was like X. For a while it was all X Games, Xbox, X blah blah blah. Now it seems Q.
I really think it's time for W to have a turn.
W.
Yeah, you think? No. Yeah, you're right. Okay. Maybe F.
F. That's a cool word. That's a cool letter.
That was a little shorter than I think.
I'm not ready. I'm not prepared to go to the next story.
I needed those extra 2.5 seconds.
Okay, so next, I think the 5 intriguing things, right? We're going to talk about. So, I'm kind of obsessed with this Atlantic writer, Alexis Madrigal, who sends out this daily newsletter. It's just 5 intriguing things, and they're pretty fascinating. You should sign up for her newsletter. But she had this one article that posed the question: should data centers be posed in outside urban areas? And the article made the case that it probably should be no, because often the first stop for these huge data centers are urban hubs like New York City, LA, Chicago. So if something happens to that city, it's automatically going to affect these data hubs. And it's compounded by the coastal cities, because a lot of times you have the transcontinental internet cables coming in there as well. So you already have this area with all of this critical infrastructure. It doesn't really make sense to build data centers way outside the area. I don't know. So it's an interesting thought. The article is kind of making the case of, well, just put it all in the urban center anyway. It's going to get affected if something happens.
Yeah, and
what do you think?
Yeah, I think it's a realistic worry. So when these cables went in 2008, this was a big thing because there were 3 major submarine cable disruptions in 2008, and they're still not really sure what caused them. It's maybe bad weather or abandoned anchors. And these were mostly in the Mediterranean Sea in the Middle East, where they would have a weather disruption, and then it would knock out huge swaths of internet services. So, I mean, we're talking 60 to 70% of the internet, 70% in Egypt, 60% in India, just because of these cable slicings. Now, and what they said after that was, well, that'll never happen in America because there are too many parallel cables in the Atlantic. You can take out any one cable and you would still be fine.
Right.
But
there's not that many, though, right? I thought there was like 3 cables that come into.
I thought that too, but there may be like 3 dozen.
Oh, really?
I haven't.
There's a map. I've seen a map of the cables.
There are a bunch
coming. Post that on
but
there.
I think the point of this article is they do hub around New York and other places like that. So if you had an incident around New York, it would slice not just one of them, but a bunch of them.
Several of them.
And I don't think any of us have really taken into account the kind of damage it would do if that level of internet service was taken down.
I mean, just look at like what happened this week when Facebook went down and like LA 911 system was being inundated by people calling, reporting that Facebook was down. Can you imagine the whole internet?
Oh my God, my timeline!
I have to take a food picture.
I didn't even know Facebook was down.
Yeah,
was it down really?
Apparently, I mean, I don't check Facebook during work hours,
right.
so
No.
I don't know. But like, yeah, can you imagine the whole internet going down? I mean, that would be serious.
Great drill. Let's do that as a drill. We're gonna call the internet up. We're gonna be like, internet, let's do an exercise.
Cyber drills are no joke.
Down.
Those are really hard to do.
Yeah,
and it's hard to do effectively because like, especially if you're running like an EOC drill for a cyber attack.
Yeah.
Like, what do you like? You have to be like, okay, nobody can use their computer or phone.
Yes.
And then it's like...
You check the BlackBerries at the door.
Right. I mean, they're really hard to do.
I would really cheat. I would get one of those new Pebble watches that connects to my smartphone, and I would check the watch.
I'd carry my like personal sat phone that I pay $800 a month to keep just in case.
Because that's how you roll.
Mm-hmm.
You know what it's time for, I think?
What?
You ready?
Drone watch.
Gosh,
it is.
That soothing robotic voice.
Drone watch.
Haunts my nightmares.
What's happening with drones?
So there's just like so much every night on the news. It's like a new drone story. I
really want a drone, by the way. Can on our baby
registry? We should go in
registry?
together and share one, maybe.
We should.
I think they're expensive.
Dukes of Hazzard drone.
Yeah,
that would be awesome.
We can paint it like orange and have a Confederate flag on it.
And we could attack other drones.
That would go over well in New York City.
I know, right? We would immediately be arrested.
There was a story out of Seattle about an Amazon employee who flew his drone up to the Space Needle and like really close to the people.
Yeah.
And so, I mean, people are doing stuff like this every day. So like the regulation is coming. It's got to happen. But the most interesting story I saw was that Martha Stewart now has a drone.
Yeah.
And she loves her drone. She gushes about it. It's the most useful tool she's had in years. She talks about the help that it gives on large scale planning projects and aerial photography. I mean, she loves it. So my question is is it over? Are drones officially not cool
right.
anymore? Like, have we missed the window?
I mean, when I think drones, I think Martha Stewart.
Right.
And that was before this whole thing happened with drones.
Yeah.
And now it's happening again. So I think we might have come full circle. In which case, what's the next thing? Like, if it's not, maybe it's little nanobots.
I don't know. Surely drones haven't run out. Like, surely we still have some, some legs.
There's some good years left.
Well, that, like, you heard the whole Amazon thing, right? They're looking into delivering packages.
I think that's exciting.
That would be really cool.
And it would, what I want is a laundry drone. Like walking to the laundromat and coming back. Like, I want a drone to carry that for me.
I mean, that's going to be a big drone to carry a
drone.
40. Like, sometimes I drop off laundry, it's like 40
pounds.
It's
like Bumblebee from Transformers. That's the kind of drone that I want.
That would be great. All right, so it's time for the big dig into Ebola.
That's right. We're going to dig into Ebola. So here's what I want to do to set the scene. I want to just see if you remember this from your childhood.
Your town is being quarantined.
We got 19 dead. You got 100 more infected. It's spreading like a brush fire.
What are you talking about?
If one of them's got it, then 10 of them have got it now. And if one of them gets out of Cedar Creek, we have a very interesting problem.
If that bug gets out of there, 260 million Americans will be dead or dying.
Dead or dying. Did he say also at the beginning of that? I don't know if you can play just the first 3 seconds. Did he say butt fire or bus fire?
Your town is being quarantined.
We got 19 dead. You got 100 more infected. It's spreading like a brush fire.
Right, it's a brush fire. It's not a butt fire.
Brush fire.
I know.
Okay.
You would think butt fire is more poetic
I was like,
use
what
of
happened
language.
in '90s that way?
Yeah,
this was a great movie, by the way. Like this, I probably only saw it one time back in the '90s, but
one time.
This was such a good movie. I mean, I probably saw it.
I saw it like 2.5 times, and then the third time I kind of fell asleep during it. But
But hearing it now, I'm like, wow, was it really this cheesy?
This is actually more. I'm just gonna play this one now because I think this shows the cheesiness.
The greatest medical crisis of all time
We can't stop it.
begins.
Try to remain calm. Many people are dying and are going to continue to die unless we find this monkey.
Find the monkey.
That's the thing. The entire plot of Outbreak, starring Dustin Hoffman and Rene Russo and Donald Sutherland with a crazy accent, and Kevin Spacey also.
Kevin Spacey was in it. Was he the guy who died?
Yeah, he was the dead guy,
right.
and was that the fate of the world turned on like a 5-year-old girl interacting with a monkey.
With the monkey,
Yeah.
And I remember the monkey screeching.
That's right.
You were like, oh my god!
I need a better monkey impression.
And then they darted that stupid monkey and they got him.
But if you remember right, the Outbreak came out after the Hot Zone, which was the big read. Yeah. And I'm just going to tell this story. It's my favorite story about the founding of the strategic national stockpile.
Oh,
Do you know
yeah.
the story?
No,
So
I don't know.
The SNS was founded in 1998, and it's because apparently the story goes in 1997, Bill Clinton was on an airplane for a long time, overnight, and somebody gave him a copy of Richard Preston's The Cobra Event, which is about a smallpox-like disease spreading through the United States and killing everybody. Basically the plot of Outbreak, but this was 6 years later, and apparently he didn't see Outbreak. But he read The Cobra Event, and he was like, crap. And so he goes out and he buys 36 copies of it, gives them to all the members of Congress, and pushes them to found the strategic national stockpile.
Are you serious? That's how it happened?
And it was just couple weeks later. No, it was a few months later. But in 1998, the SNS was founded with 15 million doses of smallpox.
That is amazing.
Vaccine.
That's on so many levels. Can you imagine how many my level project managers tried to do briefings up that this is really important. Yeah. Can we get some funding for this? It's can we get $2,000 to study this?
That's
but
right.
No, the president reads a fiction book.
Yeah.
And then all of a sudden it's institute this $1 million program for the next 30 years.
Yeah,
wow,
dude,
that's incredible.
Makes me wish I were Michael Crichton.
Yeah, I know.
He's a man that can make a difference.
Maybe that's the new emergency manager should go after fiction writers and be like, can you write about a cyber attack right now? And
yes,
slip
that's
it
awesome.
To the mayor.
Here are the 20 major threat scenarios,
Exactly.
and we would like a Harry Potter novel about each one of them.
That's what an incredible story. Wow.
All right, but anyway, that's just background. Outbreak, just so everybody knows, wasn't actually about Ebola. It was about an Ebola-like virus, whereas the hot zone was about Ebola, but it was really about Ebola in monkeys from the Philippines that were here in the United States. People in the U.S. had antibodies from exposure to Ebola, but never actually contracted the disease Ebola, and that event is what the hot zone, which is a nonfiction book, was based on.
Interesting.
Yeah. So, but Ebola.
Yeah, so I mean that's kind of all in the news today as far as like public health and emergency management.
Yeah, just a little bit.
Yeah, just
my
slightly.
Facebook feed. It must not be down today because it's like exploding with everybody saying we're gonna die from Ebola.
Yeah, and most of it is a little bit off base, I would say. I think
I like that. It's a little bit. You're being very generous.
Yeah, a little bit hyperactive. I think, the New York City. What do you call them? New York City, they're not tabloids. Probably call them tabloids, like the New York Post and the Daily News. Front page, 6-point font is just like Ebola is taking in the city, and it turns out that like Ebola's not in the city as far as we know yet. Maybe, but at this point it's not.
No, definitely.
But it's like hospitals are being careful and they're screening patients who
the best headline, I think, was the one you found, right? Which was
from
headline.
The Onion.
Yeah.
Yes, that said Ebola vaccine at least 50 white people away. And it has a quote that, while all measures are being taken to contain the spread of the contagion, an effective, safe, and reliable Ebola inoculation unfortunately remains roughly 50 to 60 white people away, if not more. And so once again, the Onion hits it.
And this week has incredibly borne that out. I mean, the thing about this kind of Ebola freak out that's happening in this country, which I guess freaks me out in turn. So my secondary freak out is that it feels incredibly, do I say racist, continent-ish?
Insensitive. I don't know what the word racist gets thrown around a lot, but it's on that. It's on
like
that
a
line.
worse word than racist to me.
Yeah.
And the reason is because we're freaking out over nothing, like absolutely nothing.
Privileged? Yeah, I don't know.
Yeah, and where the real story for this is the story that's been happening in West Africa for months and months and months.
Right.
And it makes me really angry that that's sort of, it's taken all of this, and so everybody's sort of Twitter feeds are lighting up about this stuff now, where this has been a major catastrophe in West Africa for a long time.
Yeah. Yeah, I mean, this for sure isn't the first outbreak that happens. It's the most significant one that's happened in a while, but really, like, our energy, our resources should be going to help the people in West Africa, not kind of getting spun up on the potential of things happening here. Like, I even heard that, like, Tulane University down in Louisiana is getting, like, hate mail for accepting the 2 patients. Like, people are actually, like, taking the time to write letters to the university upset that they brought these Ebola patients here.
And I think it's Emory that's receiving
Emory, sorry.
Right. No, let's, as a
Georgia.
No.
As journalists, we should be accurate.
We should be very accurate about that. But, I don't even care so much about the 2 I mean, I think that, I guess here's my point. The 2 patients that we received and gave this mysterious emergency serum to, and suddenly they're miraculously better, proves the Onion headline, to a T.
Exactly.
The fact that and here's the other detail about that is they were each flown in on a private jet with 1 tent in the jet. So it can only take 1 patient at a time because the whole jet is devoted to 1 isolation tent in the middle of it.
Yep.
And in the meantime, at least 800, 900 people have died in West Africa from this without any of these extraordinary measures. So what I would like to do is just take a minute here for any loyal listeners that are there, and let's start at the top of this and kind of chew through it and sort of look at what Ebola looks like. So Ebola itself, so everybody knows there are 5 strains of Ebola. The first strain was found in Zaire. Now there isn't a Zaire anymore, the Democratic Republic of Congo now, but it was found in 1976, and it's the most deadly strain of Ebola is Zaire Ebola because it has up to a 90% fatality rate. Now, the new fatality rate for this outbreak is like about 60%, which is good. It's hopeful. It means with some supportive measures, maybe we can sort of keep people alive more. So, but it started, okay, so let's just rewind back to February, back when all these people were dying from cold wave deaths, apparently, and we didn't know about it. So, it started in Guinea, and it was registered February 9th. So, February 9th of this year is when this massive Ebola outbreak starts. Okay, so aid agencies start, and the major aid agency that's involved is Doctors Without Borders, and the abbreviation for that is MSF,
Yep.
which stands for Medicines Sans Frontiers, which
Yes.
I can't pronounce that, actually.
Right. Which the translation, if I'm accurate, is Doctors Without Borders.
Oh, look at you. Did you take French in
Oui,
college?
oui.
Oh, damn. You the language of love. So, all right. So in the middle of March, this outbreak, which has been kind of mysterious till then, Guinea confirms that it's outbreak and it's Ebola, and it's killed up to 59 people. So the reason this is important is that this is actually the first time there's been a West African outbreak of Ebola. Before this, it's been more in Central Africa, and the countries where it's been have built up a system for handling it. People tend to sort of clump all these African countries together, but I mean, there's no basis for that. And so the countries that have been dealing with it usually by now have built up more of a public health infrastructure for it. They sort of have protocols and procedures, and most importantly, people are taking these infection control practices more seriously. So
and it's also been happening in primarily rural areas, right? So it's been a little bit easier to contain. I'm talking about previous Ebola outbreaks,
so this
right?
is,
it hasn't hit the big West African cities.
Yeah, we're talking about Uganda. We're talking about the Democratic Republic of Congo. And so these areas, and when we say these areas, we're talking about Guinea, we're talking about Liberia, and we're talking about Sierra Leone, have these three factors that are really important, I think. One of which, and Mother Jones did a great piece about this, is they're being rapidly deforested for mining. So these initial outbreaks seem to be linked to mining colonies. They have rapid inter-country commercial travel, which Uganda and those other places didn't so much. I mean, here people are going across the borders all the time, so there's a much richer infection kind of zone. And three, the public health infrastructure and the government have been decimated by conflict over the past few years. So you've got a place where the natural environment is being deforested, the infrastructure and the government has been decimated, so there isn't really a good infrastructure to address this outbreak.
Right.
And so what happens is an organization like Doctors Without Borders goes in and has to sort of recreate an entire public health infrastructure, which is, it's just sort of doomed to fail, you know? I mean,
well, it's a classic complex emergency, right? And like, you can't go in with an isolated response. There's like a structural emergency response that has to take care. You have to handle the environmental issue, the public health issue, the government regulation issue. I mean, there's just like, it's so complex to try to handle this response.
And that's what starts to happen, because at the end of March, so we started in Guinea, right? End of March, Liberia confirms that they have 2 cases of Ebola among 27 tests. So they were in this place where they're testing everybody. They find 2 cases. Guinea reports 80 deaths at that point. And one thing that happens is that 2 probable victims of the disease in Guinea get repatriated to Sierra Leone. So the bodies go to Sierra Leone. So why is that important? Because of funeral practices. One of the major risk factors here is that there are really intensive hand-on body funeral practices in terms of cleaning bodies and preparing them for burial that are in play that are kind of a major infection risk factor. But the real thing at the end of March, WHO doesn't recommend that we stop travel between Liberia and Guinea or Sierra Leone. Free travel is still kind of in play. And so it gets a little worse in April. By mid-April, we then have 122 deaths in Guinea. Then Liberia and Sierra Leone, we have people under surveillance but no cases. But then the big factor that's really marked this is healthcare workers start dying. And this is back in the middle of April. 13 healthcare workers are dead out of 24 that are infected. So already this kind of pattern is starting, right? So here's the big turning point. This is the thing everybody should know. In May, it's sort of everything starts getting worse, and in the middle of May, it seems like it's plateauing out. So in Guinea, they haven't reported cases for almost a month. Liberia, no new cases since that like mid-April spurt, and still no confirmed cases in Sierra Leone. And what seems to happen is WHO said the leadership kind of got reckless. They were like, it's done now, everybody relax, chill out, and they kind of cycled back on it. everybody, you're fine. Go back to eating the bushmeat. Do the funerals, and because of that, May 23rd, there is an outbreak that happens in Sierra Leone, 4 cases, and from then it just happens start like wildfire. There's that outbreak in Sierra Leone was one that was right on the border of Guinea, and then it crosses back to the border of Guinea, and the death toll goes to 186 cases, and by June it's happening all over. Traditional healer dies, more healthcare workers die, and it just kind of gets worse and worse. So July. I know I'm like ranting about Ebola, right?
No, it's
but I want to. What happens in July is it's clearly beyond the capability of Doctors Without Borders, right? There's no public health agency to take it over. So the WHO convenes this meeting of health ministers from countries that are around there. They say, look, these traditional beliefs like funeral practices that are happening, densely populated areas, cross-border transmissions, these are problems. You guys need to do something about that. And at the same time, the Doctors Without Borders folks say, listen, it's beyond our control. This is spinning outside of our control. We need more money and we need more resources. And the thing I'm critical of us kind of here at this point is that was a major cry for help, right? It's a massive African conference. Massive outcry for help. And it really didn't register, I think, on our radar here anymore, right? It didn't register till July 25th, where we have this American Patrick Sawyer who is working for Liberia, who gets to Lagos Airport in Nigeria, and he collapses, and then he later dies. And I think that, suddenly it was like, oh, that's the first, it's like the first white person on the Onion's 50 white person count.
Right.
Kind of goes down.
49 to go.
That's right. Yes. 49 to go. And then we have the doctor leading Sierra Leone's fight against Ebola goes down, and we have then other dozens of healthcare workers, and we have the infection of the 2 American medics, and then another doctor who's a leading doctor in Guinea dies. So I feel like that's when our consciousness kind of gets going in, when the healthcare workers that are the major players die, when the Americans die.
Yeah.
So what happened today and yesterday, and today is August the 5th, the troops in these countries were called up to go in and do logistics. And to me, it's almost like they finally activated ICS kind of. Right. They're using the troops to enforce quarantine zones because of the doctors who were being attacked, like the Times reported on. There are villages where they wouldn't let the doctors in. Only like 12 of them or so, but that meant they didn't care for those guys.
Wait, villages didn't want doctors coming in to treat patients because they thought they were bringing in the disease, or just a misunderstanding of what the doctors were doing?
No, that's exactly right.
Are these Western doctors coming in?
It's Doctors Without Borders people. And this is the thing, right? I think Doctors Without Borders focuses on the medicine, right? They're great at the medicine. Maybe they're not as good at the cultural practices, right? But they're working on it. But what happened is the association was between Western doctors and the disease. So villages started banding together and kind of reverse quarantining, saying they wouldn't allow medical staff in. And there was the case of a patient like escaping or walking out of a healthcare facility, another one where the family of a patient came to take him from an Ebola clinic, and both of those cases ended up dying and also infecting the people that had sort of rescued them from these healthcare places. So the soldiers are supposed to enforce the quarantine in these villages, make sure they follow infection control practices, and then do the transit and communication work.
Yeah, which is tough, I think, because I think probably soldiers aren't really very well received or loved in these communities. I mean, I've done some work in East Africa, and I think it's, maybe have similar challenges here. And so, introducing soldiers, introduce soldiers here in America to a disaster response. It's not, there's tension there. So I can see how that would heighten the tension and the kind of the situation.
Yeah. And so from this from ABC Australia, this operation is codenamed Octopus, first of all. Which is, and I feel like military code names first should be like more cuddly in a situation like this.
I think we need to get rid of this trend of naming. I mean, I guess the military operations, whatever, but
you have to give them some. But like, it could be like Operation like
Healing.
Wellness. Yeah, that's right. Feel better.
Operation Great Public Health.
There you
Intervention.
go. That's what we need. Octopus. And so what we have are 750 trucks They're going to implement the quarantines. We have convoys of people going forth, and police are containing infected communities. They're setting up checkpoints, roadblocks for entrances and exits, all that kind of stuff.
I mean, this is the movie, right? This is Outbreak happening in these communities. I mean, that's. Can you imagine if that happened here? Like what people would do? They'd freak out. I mean, I'm sure it's happening there too.
I was actually funny story from Florida. I think it's been long enough that I can tell the story.
The statute of limitations has went out.
First year I was working for Florida, I went to a smallpox exercise, and at this tabletop we were talking through an infection scenario very much like this, how we would implement some kind of quarantine, whether it was even necessary, because in some ways, what you want is voluntary isolation of these people, right? You don't want to lock them up because of all the bad stuff it does to the culture. But in this case, the people around the room, the doctors were like, yeah, we've got a quarantine, and we're going to put them all together on this farm, and we're not going to let them leave. And so it was like, okay, well, so the entire population of this North Florida city is now on a farm together being quarantined. And then the inject was one of them, tries to run. Somebody wants to escape from the farm.
Shoot him.
Honest to God.
No.
Yeah.
Are you kidding
Somebody
me?
from Florida Highway Patrol is like, well, clearly, if they're going to run and they might infect other people, we're going to drop them.
Gotta take them out.
That's right. They were exactly right.
Oh my
We were all like,
gosh.
oh my God, really? That's what you would do?
This is why you need limits on government.
Oh, which reminds, so this, I think from Outbreak, this, I think, is the speech that gets us there. This is, and it has to be, the only actor who could deliver the speech, right, is Morgan Freeman.
Do it.
Now, I know that some of us have doubts about what we're about to do. We'd be less than human
Right?
if we didn't.
Right?
But the fate of the nation, perhaps the world, is in our hands. We cannot, we dare not refuse this burden. I'm confident that each of you will do his duty. God forgive us.
That's right.
God forgive us.
God forgive us.
If you could give that speech before every emergency activation, I mean, I think that would really help morale.
I actually think that's the last speech that you want to hear, because I think right after
As
that
you
speech,
swivel to your keyboard.
that's when
to type.
it's when the cop shoots the guy. I think that's the speech you give before the cop starts shooting.
Was that right
people.
before the airline pilots were going to drop the bomb on the
Spoiler.
village? Oh
No. Yeah, that was right before you ordered the nuclear strike on
Yes.
Colorado or
On
wherever
the-
it was.
Yeah, on the town.
Wow.
I mean, there's just there's a lot of things this makes me think of. One, at what point do U.S. public health officials start taking notice of these outbreaks that are happening in faraway places? I mean, we're so connected, right? We're one plane flight away from the disease reaching us. So, at what's the appropriate point, and who is the appropriate alarm in other countries to kind of bring this to attention for us to start preparing for it? I know the CDC has a watch center, right, that they monitor this stuff.
Yeah, and CDC is actually the organization of record. I think even more than the WHO for epidemiologic strike teams like this.
Mm-hmm.
CDC was investigating this thing early on, and they just sent 50 public health workers over there to advise on it. WHO is trying to pull together a $100 million budget to fight this outbreak, and we've sent, it's kind of like when the U.S. sends an advisory team to Iraq or something. We've
Right.
sent these 50 public health
Advisors.
people
Yeah.
to start, trying to educate everybody and implement these practices. And the real burden seems to be, because again, this is the first Ebola outbreak in these regions, which I think is partly why it's so bad, convincing people that seriously, I've got to wear gloves all the time.
Right,
I
right.
can't bury my grandmother.
Yeah.
I mean, it's that kind of thing.
Right, it's these cultural sensitivities
Right.
that are really hard to get past.
Yeah, and one of the big ones is actually roasted bushmeat, because that's a major economic thing. Is
Right.
roasted is grilled bushmeat on the side of the road, and getting people to give that up is a tough thing economically.
changing
and socially.
behavior is always the most difficult thing to do in public health interventions. I actually saw an article today that talked about possibly the need to start vaccinating monkeys for Ebola.
Oh,
Isn't
yeah.
that interesting? Because
Uh-huh.
and to help prevent the spread, which I thought was
It
fascinating.
would have helped an outbreak if they just vaccinated the damn monkey.
I know.
Then nothing would have happened.
Well, they got the monkey, so all is well.
But was it, Andrew? Was it?
I don't know.
So I think the future of Ebola is honestly not great, right? I mean, I think that
Well, these type of outbreaks are going to continue to happen, right? As the world population grows, as we become even more and more connected.
as we cut down these forests that where a lot of the reservoirs for these diseases are, and we
Right.
expose them,
Yep.
I think they are going to happen more. And I think we need to do a better job, country by country, of responding to them.
Yeah.
And to me, though, the biggest problem is the thing people aren't really looking at, which is that if Sierra Leone, if a Guinea had an existing public health infrastructure, if they had communicable diseases bureaus, if they had epidemiologists, even on a minimal level, they could kind of respond to this stuff early.
Yeah.
But every time there's like a war, or an economic crash, or they're burdened by debt, like every time that's it, they can't build that capability.
Yeah, right. I mean, it's low on the priority list. I mean, I keep going back to the idea of complex emergencies and how you respond to those. And, in a multifaceted problem, it's like almost you need like multidisciplinary teams to go in and attack the underlying issues on multiple levels. But, I mean, that is just like very difficult to do. Takes a ton of money, takes a ton of skilled people who are willing to give up, their lives to go work in this, war zone. That's a really tough problem.
If we could somehow harness all of the tweet energy, right, from like this week of Ebola craziness in the United States, just like letter by letter, just like harness it
Right.
and inject it into like African economies to build up infrastructure.
Yeah.
I think that would change the world.
It's tough. It's tough. Good one.
Is that,
Good one.
yeah, was it too far? Did I go too? Was it too far?
No,
do you
no,
think?
no.
Okay.
That was good.
I think that.
So along those lines, this quick article on one of my favorite places in Brooklyn is the Brooklyn Historical Society. And they have they send out a great newsletter. They have this article on the smallpox epidemic of 1894.
Oh yeah, I remember
Brooklyn.
that one. That was fun.
And it's really cool. It's kind of along the lines of what we're talking about here. It's the balance between government intervention and individual rights. So the U.S. Supreme Court just upheld a New York City policy of preventing unvaccinated students from attending public schools while another student has a vaccine preventable disease, if that makes sense. And so it goes into this great background of this fight, this legal fight, and this cultural fight has been going on literally since the 1800s. And they bring up, old lawsuits from this guy, John Solomon, who sued for injuries he received as a result of a forced vaccination. Basically, a public health worker came to his house and said, "Are you vaccinated?" He said no, and they told him he had to be vaccinated, so they forced it on him, and he did not like that, and so he sued the government. And so, it's so interesting because the public health side of me is like, absolutely mandatory vaccination of everything. Everybody should be vaccinated. No,
Vaccinate the monkeys.
Yes, vaccinate the monkeys, the
bushmeat,
people.
vaccinate
Just
the
have
trees.
needles sticking out everywhere
Yeah.
that vaccinate people as they walk by. But we live in America. You know what I'm saying, Mitch?
America.
We
With
live
a
in
W.
America.
Yeah.
And we have personal freedom and personal rights. And so there's this other side of me that's like, you know what? It's my decision whether I want to be vaccinated or not. So I think this debate will continue. And Brooklyn Historical Society has a great blog entry on their article if you want to read more about it.
And I think what I love about this is it also chronicles the history of sort of damned if you, damned if you don't.
Yeah.
Because the John Salmon, I guess it's salmon like the fish. So I don't know. He sued for those injuries, and then there's this other guy, Robert Goggin, which just I think last names were different in the 19th century than they are today. So Bob Goggin also sues.
Bob Goggin. Do you know him personally?
No, yeah,
You just changed
Bobby
his
Goggin.
name from
Good
Robert
old Bobby
to Bob.
Goggin. And
Old Bobby G.
Yep,
on Atlantic Avenue.
So Bobby G sues the city because his wife and his daughter died, because he's arguing that the city failed to remove a smallpox carrier from his apartment building. So essentially he's suing the city because they didn't find the sick person and seize them and take them away.
Quarantine them,
Which
yeah.
is if you give people the vaccine, people are going to sue you. If you don't seize people and throw them in quarantine, they're going to get you, which is maybe the essence of government work a little bit.
Right, and it's going to continue to happen, right? There's going to be this fine line, this balance between how much can we do, and how much personal freedom do people have
And
that we have to respect.
One day that maybe there'll be a Brooklyn Historical Society exhibit on Ebola.
It'd be great.
And it'll showcase all the tweets. So I love this. Just to end on, this is even from December 2011. So this is maybe the oldest news that's ever been reported.
Breaking news from December 2011.
It was a good year. In 2011, CDC did this blog post that was the top 7 disaster songs countdown. Just a couple things. I've never heard of a top 7 countdown before.
Could they not come up with 10?
You at least should try and come up with 10.
Are there really not 10 songs out there?
But the other thing about it is most CDC blog posts, there aren't a lot of comments. Do you know what I mean?
Yeah.
But this one, it just keeps going. People are like, oh, I want to do this song. I want to do this song. I want to do this song. So we'll post the link to this. But I want to ask you, first of all, to name the top number 1 song.
I don't know if I can name the number 1, but I think... So ones I always think of are like "Rock Me Like a Hurricane." Is that on the list?
It's on. That's number 7. We're just like Family Feud. Ding ding ding.
Oh,
ding,
number
ding.
7. That's number 7.
Number 7.
Oh man,
Yeah.
We Didn't Start the Fire.
Oh, it's number 5.
We didn't. Tornado Rock. I don't know. That might
really. There's one just floating there.
Man, Hurricane. Sea of Love.
Sea of Love. What?
Ebola.
Really? That's right.
Disease.
Ebola
There's got to be
fever.
something with this. I don't know. I don't listen to radio anymore.
All right. I'm going to tell you then.
Okay.
So I'm going to count them back from 7.
From 7. Okay.
So 7 is Rock You Like a Hurricane by the Scorpions. Number 6 is Trying to Reason with Hurricane Season, which is a Jimmy Buffett song.
Never heard of that.
But he's actually done a better hurricane song than that. Well, actually, my favorite apocalyptic Jimmy Buffett song is "Party at the End of the World."
Oh,
he
that's
has this
good.
great
Oh,
song.
it's the end of the world as we know it. That's got to be on there.
Oh, you got it. Yes, that's number 1. So just spoil the surprise.
Sorry.
5 is We Didn't Start the Fire. 4 is Natural Disaster by the Plain White Tees, which I've never heard of. I don't think that's a real song, and I feel like they should just cut that.
That's like some CDC epidemiologist has his own band,
Yeah,
and
he's
it's
like,
like,
I love
oh, this
the
is a
Plain
really
White Tees. Oh my God, this is the best band
It's really
ever in the
popular.
world.
South Atlanta.
3 was Landslide by the Smashing Pumpkins. But was that actually wasn't that by Fleetwood Mac?
Yeah, I'm thinking of the Fleetwood
Yeah,
Mac
I think that's a
song.
cover. So I think basically the CDC does not know their music the way
we need to
they think
update
they
this
should.
list.
Okay, number 2.
Yeah.
Ready
Yeah.
for this? Because I'm just gonna say this is your contemporary Christian shout out for the show.
Oh my God, I'm so excited.
It's "Flood" by Jars of
Oh,
Flame.
Flood! Yes. Oh, I saw them in concert. I saw them in
I
concert in the late 90s.
never knew that song was about a disaster. Is it about Noah? Is that what it's about?
I think it's about the flood of love that comes from. No, I have no idea.
I think for the next show we do need to review Noah. We need to set that. As a thing. But a couple of things in the comments that I really liked were "Volcano" by Jimmy Buffett, which is another good Jimmy Buffett disaster song, which makes me think we should have Jimmy Buffett on the show. "Beds Are Burning" by Midnight Oil.
Oh yeah.
Do you remember that? That's a good
one.
song. And "Eve of Destruction" by Barry McGuire, which is a great song because you don't know that
We've
song?
got to update this list.
Do you know that?
No.
'Cause that song I remember because it was in Greatest American Hero.
Oh,
That was the song that always played on the radio. Do you remember Greatest American
I
Hero?
remember that, yeah.
The radio would go like,
Uh-huh.
and it would always tune to the channel that was playing "On the Eve of Destruction."
Interesting.
Yeah.
Wow.
So anyway, those are the songs.
I think we need
the
an
CDC.
updated list. Maybe we can do one that's like from 2011 to current day.
To now.
You think we can come up with 10 disaster songs?
Oh yeah. Do you think we could get CDC to post it?
Ooh, maybe.
There we
I
go.
don't know.
That's a good challenge. Let's see if we can get them to update their.
I'm
their
sure.
list of
Yeah,
songs.
I'll write my congressman.
All right, let's do.
Got
Be
nothing
like,
else going on.
I'm gonna give you Ebola. Actually, one more
Yeah.
story. Here's my one more story.
Okay.
So it's just before.
It's never
All right,
mind.
It's 2001. Okay.
Yeah.
In 2001, before September 11th, I think. But before. Yeah. Okay. I know this story. I promise. CDC. Not even CDC. Johns Hopkins.
Oh my gosh.
And
Are you making this up? Are you improvising right now?
Thomas Inglesby, who's the head of the Center for Biosecurity, and Johns Hopkins, some strategic something center, hold this exercise called Dark Winter. And Sam Nunn pretends to be the president. They have all these people pretend to be the levels of government, and they do a smallpox-like scenario where like everybody dies in the country. And then they come, and I think this part is after September 11th, but before the anthrax letters. They come to brief Dick Cheney on the results of it.
Wow.
And so the guy that ran the exercise goes through, and this is in a great Times piece from 2011, goes through security in the White House. And security in the White House is not just metal detectors at that point. It's bomb sniffers. It's chemical sniffers. It's incredibly secure.
Yeah.
He goes through all of it with his briefcase, and he gets in front of Dick Cheney. And at the end of this presentation about how the U.S. is not prepared for biowarfare, Dick Cheney says, well, what's the biggest threat? And this guy says, well, I'll tell you, Mr. Vice President. And he opens up his briefcase, and he takes out a little vial of weaponized bacilli, which is a close cousin to anthrax.
No, he does
not. So it's
not.
a spore. It's a little weaponized spore.
No.
And he says, it's this right here, Mr. Vice President. And I just smuggled it into your office.
Oh, my God. Are you kidding me?
No, it's a true story.
The cojones on that guy.
I know, right?
Are you serious?
One step away from treason.
Yeah.
Right there. It wasn't actually anthrax. I think that's what saved him.
Right.
But it's like
was it something that could make him sick?
It wasn't. Not really.
Yeah. But still, it's just for the effect of wow.
Yeah.
What a guy.
Hey, really, I want to meet that guy.
That's amazing.
Yeah. I'm not that crazy.
So did like that funding increase for bioterrorism?
I think that's right after that,
Until
right?
9/11,
01, 02. That's when the big funding jumps happened
right.
for biowarfare, and I think that is directly related to I think he scared the shit out of Dick Cheney.
Yeah.
That's what I think happened.
I bet.
All right. I have to play one more of these.
It's our sad, ominous closing
That's right.
music.
It's almost. It's time to be done.
Hey, it's good to be back. It's
one
been
more
like
hour of come to an end. I know,
8-week
Has
little
it been
break.
8 weeks?
The funny thing is, it wasn't on purpose. Like every week we're like, all right, let's get together, and then something would come up. We'd get sick.
We should have. What we should have done is been like, that's season 1. Season 1's over. Now you're gonna have to wait a hiatus for.
We were writing season 2.
That's
we
right.
were writing
whole
this
time.
episode.
We were locked away.
So thanks everyone for
redrafting.
listening. Thank you for continuing to email us and come to the website. You can go to Hazards Podcast for links to all the articles we mentioned. We'll try to get that up in the next day or two. You can email us at hazardspodcast@gmail.com with questions. Please give us suggestions for the shows. What do you like? What do you not like? What do you want to hear more of? If you want to be on the podcast, hey, we'll talk to you. You can do this news rundown with us, or if you want us to interview you, that'd be great. If you have time, give us a review on iTunes. Follow us on Twitter. Our handle is Hazards Podcast. Give us your credit in your emergency plan that you write.
Oh, yeah.
I think we deserve credit.
We would like attribution.
Any idea you take from this?
Could somebody just start a flame war with us? Because wouldn't that be? I would love to just be in a flame war.
Like a Twitter.
With somebody. Yeah, on Twitter
you're
or something.
dumb.
Somebody call us out like the way that Common called out Drake or something. We could have an East Coast,
something
West
really
Coast
important.
thing.
Or Orlando Bloom punching Bieber. That happened this week.
Oh,
Maybe one of us will get
Didn't
punched.
Bieber save someone from a bear?
No, that's got to be made up. Come on.
No, that happened. I swear. Bieber saved somebody from a